Insulin resistance is one of the most misunderstood terms in modern health. Many people are told they have insulin resistance, but very few are told what it actually means, so let's explain it clearly. Insulin is a hormone that helps move glucose from the bloodstream into your cells, where it can be used for energy. When insulin is working properly, this process is smooth and efficient. Insulin resistance happens when your cells stop responding to insulin as well as they should. The insulin is still there, but the message is not getting through. As a result, glucose stays in the bloodstream longer, and the body has to produce more insulin to compensate. This is not a sudden failure. It develops gradually over time. Insulin resistance often begins years before blood sugar becomes abnormal. According to medical guidance, insulin resistance is strongly linked to excess fat stored around the abdomen and internal organs. This type of fat interferes with how insulin signals work inside cells. Muscle, liver, and fat tissue all play different roles. In the muscles, insulin resistance means glucose is not taken up efficiently after meals. In the liver, insulin resistance means glucose continues to be released into the bloodstream even when it is not needed. In fat tissue, insulin resistance leads to abnormal fat storage and inflammation, which further worsens the problem. This explains why insulin resistance affects more than just blood sugar. It is closely linked to high blood pressure, abnormal cholesterol, fatty liver disease, and increased cardiovascular risk, a condition called metabolic syndrome. Many people assume insulin resistance is simply caused by eating too much sugar. That is an oversimplification. Diet matters, but insulin resistance is influenced by multiple factors. These include genetics, excess visceral fat, lack of muscle activity, poor sleep, chronic stress, hormonal changes, and physical inactivity. This is why two people can eat similar diets and have very different metabolic outcomes. Insulin resistance is the core problem behind prediabetes and type 2 diabetes. In the early stages, the pancreas compensates by producing more insulin. Blood sugar may stay normal for years. Over time, the pancreas struggles to keep up. That is when blood sugar begins to rise. In gestational diabetes, pregnancy hormones increase insulin resistance as part of normal physiology. In some women, the pancreas cannot produce enough extra insulin to overcome this resistance, leading to high blood sugar during pregnancy. This is not caused by poor choices. It is driven by biology and hormones. Insulin resistance also explains why weight alone does not tell the full story. Some people with a higher body weight remain insulin sensitive. Others develop insulin resistance at a much lower weight. Where fat is stored, muscle mass and metabolic health matter more than the number on the scale. So how is insulin resistance managed? There is no single fix, but there are powerful levers. The first is muscle activity. When muscles contract, they absorb glucose directly, even without insulin. This is why walking after meals, regular movement, and resistance training improve insulin sensitivity. The second is reducing visceral fat. Even modest weight loss can significantly improve insulin sensitivity because it reduces fat around internal organs. The third is sleep. Poor sleep increases insulin resistance within days. Consistent, adequate sleep improves glucose handling independently of diet. The fourth is stress management. Chronic stress raises cortisol, which worsens insulin resistance and raises blood sugar. The fifth is nutrition. Whole, minimally processed foods reduce glucose spikes and insulin demand. Protein, fiber, and balanced meals support better insulin signaling. For some people, lifestyle changes are not enough. Medication is not a failure. Medications can reduce insulin resistance, improve insulin action, or reduce glucose production by the liver. They protect organs while lifestyle changes take effect. Insulin resistance is not a personal weakness. It is a common metabolic condition driven by modern lifestyles interacting with human biology. The good news is that insulin resistance is modifiable. With the right combination of movement, nutrition, sleep, stress management, and when needed, medication, insulin sensitivity can improve. Understanding insulin resistance changes how you approach diabetes. It shifts the focus from blame to biology. And that is where real progress begins. If you want diabetes and metabolism explained clearly, calmly, and without extremes, this channel is here to help you understand what is happening in your body and what actually works. Like and subscribe for more useful content.